Thank you. Your Excellency, Mrs. Haifa Abu Ghazala, Assistant Secretary General, Head of Social Affairs Department, League of Arab States, Professor Habib Hadira, President Director General of the National Board of Family and Population, Government of Tunisia, Chair of the Arab Council on Population and Development, and Honorable Secretary of the Board of Partners in Population and Development. Dr. Luay Shabana, Regional Director, UNFPA Arab States Office. Distinguished panelists, delegates, colleagues, friends, and partners, ladies and gentlemen, Assalamu alaikum wa rahmatullahi wa barakatuh. Good morning, good afternoon, and good evening. On behalf of the organizers, I wish to welcome you all in this joint collaborative event between the General Secretariat of the League of Arab States, the UNFPA Arab States Regional Office, and Partners in Population and Development. And I wish to take this opportunity to thank the League of Arab States for the continued and greater support to the member countries in the Arab region, and also the UNFPA for the assistance and also for the support they are providing to all member countries, and also to PPD and to the League of Arab States. Today's virtual meeting is offering an exceptional platform for discussion and sharing of best practices, experiences, and approaches from different countries on the theme of Islam and reproductive health and family planning, with the aim to launching initiatives and creating opportunities for South-South and triangular cooperation among our member states and with other developing countries. And this is the mandate of Partners in Population and Development since its launching in 1994 at the International Conference on Population and Development by 10 developing countries. Many of them were recognized by UNFPA as success stories in family planning, and out of which 5 are Muslim countries. Today, PPD is grouping 27 member countries with different religious beliefs and worships, but all committed to the founding principles of South-South cooperation for the attainment of the ICPD and the SDG by 2030. The program of action of the International Conference on Population and Development, adopted by 179 nations, including many Muslim countries, called for universal access to family planning services, and thus no social or cultural barriers should prevent women from free choice and access to full range of safe and reliable family planning methods. Since then, several initiatives have been taken by PPD and by its member countries through effective and transformational South-South cooperation programs and activities to fulfill the promise they have taken in Cairo. Capacity building of imams and religious leaders, exchange of visits, and organization of study and observation tours and seminars have been carried out to share best approaches in dealing with Islam and reproductive health and family planning for successful implementation at national level. Examples are many, and some will be presented by the delegates representing PPD member states like Indonesia, Tunisia, Egypt, Bangladesh, and Morocco, whose experts provided technical assistance to some other countries like Mali, Senegal, Niger, the Gambia, and India. PPD facilitator training through countries with the recognized expertise and experts in promoting their programs with support from Muslim religious leaders. These efforts contributed to enlighten the thinking and convince changed behavior of many religious leaders in developing countries to advocate for more tolerant Islam, offering equal opportunities for men and women to live decently. Excellencies, distinguished delegates, ladies and gentlemen, today's event is concretizing the Memorandum of Understanding signed between the League of Arab States and Partners in Population and Development in December 2020, and is opening a new era of collaboration and partnership involving all member states of both organizations to work together towards the improvement of their population policies and reproductive health programs for the attainment of the ICPD program of action and the SDGs by 2030. PPD, through the strong commitment of its member states and its robust intergovernmental organization, stands ready to contribute to the efforts of the League of Arab States in improving the health and well-being of the people in the region of our common interest and beyond, so that no one will be left behind. We hope that our conference today will contribute in promoting the exchange of experiences and achievement to enrich field experiences and best practices through reciprocal and participatory learning that would respond to population challenges. Second, we wish that highlighting the good and effective practices that have been applied in the field of reproductive health from an Islamic perspective for replication in other countries with similar social and demographic contexts. And third, for strengthening South-South cooperation between member states of the Arab Council for Population and Development and members of Partners in Population and Development. Excellencies, distinguished guests, ladies and gentlemen, in response to current COVID-19 crisis and post-COVID-19 management, PPD and the League of Arab States will come together to undertake series of activities on sharing of experiences from Muslims and non-Muslim countries in order to solve the emerging reproductive health issues caused by the pandemic and strengthen the existing collaboration between the Arab countries within the broader framework of South-South and triangle cooperation. I wish to call upon the governments of the Arab countries through the distinguished representative in this conference to join Partners in Population and Development and strengthen the voice of the South globally for better response to the needs and aspiration of more than 80% of the world population, including 1,025,000,000 Muslims in the world. I wish you success in your endeavors and thank you very much for your attention.